Which is the best Medicare supplement plan for me? Well, we'll talk about that. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. All right, which is the best one for you? Well, it's the one that fits your needs and your budget. I mean, that's basically the way it comes down to it. I'm not going to tell you which plan you should have. That's really up to you. It's a personal decision. There are agents out there who will tell you this is the plan that you really need to have, and let's just go ahead and get you signed up and all this kind of stuff. That won't happen here. This is what I call a no selling zone. But the three most popular plans in Georgia right now, there are 9 different ones, I think it is, and not all the carriers write all the plans, but every one of them offers a G plan. And the G plan will pay your Medicare Part A deductible. Part A is hospital inpatient. It's a pretty good size deductible, but you don't have to worry about that because the G plan pays that for you. There is also a Part B deductible, Medicare Part B. The Part B deductible is all of your outpatient health care. That's doctor visits, labs, MRIs, CAT scans, emergency room, and ambulance, and all the health care that you can get on the outpatient basis. There is a calendar year deductible there. The G plan does not pay that. That is your responsibility. But after that deductible is satisfied, Medicare pays 80% of the charges. Your G plan pays the other 20%. So you really have very little exposure. It's easy to budget, even if you have a year or two where you've had a lot of medical expenses. It's very easy to budget for your out-of-pocket expenses. G plan is by far the most popular plan out there. Probably 90% or more of the folks who are on original Medicare will go with the G plan. So it's, if you want to be like everybody else, and there's nothing wrong with that, the G plan's for you. I'll be glad to talk to you about it, give you rates, and answer any questions you may have. The next plan will save a little bit of money. It's for folks that want to, or maybe they're on a tight budget, or they just say, okay, I'm willing to take on a little bit of extra risk in exchange for some premium savings. The N plan is very much like the G plan. It's very similar to it. The difference is after you have satisfied your Part B calendar year deductible, there is a doctor visit copay. It's a formula. It's not a flat amount. This is, this is the way Medicare set it up. It's a formula, and your copay will not exceed $20. So it could be less than that. It'll never be more than $20. So that's one thing that you need to know about. There's a few other little quirks to the N plan, but I'll be glad to discuss those with you if it's something that you're interested in. The last plan is a high deductible G plan. It's basically the G plan that I described earlier, where you pay your Part B deductible, calendar year deductible. After that has been satisfied, then you have an out-of-pocket deductible. Currently, and this is 2020, currently it's over $2,000. That's over and above your Medicare Part B deductible. So if you have a bad year, you can still budget your out-of-pocket, but it's going to be several $1,000s. There is a premium savings there. There's no question about it. G plan premium, high deductible G plan premiums are about half of what the G plan is. So if that's something that's of interest to you, it's not for everybody. I'll be glad to share rates with you on that and answer any questions you may have about the high deductible G plan. Those are the 3 most popular plans. Be glad to just, any questions you've got, give me a call, shoot me an email. I'll spend as much time with you as you want and answer your questions because I want to help. That's basically the bottom line. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care and have a great day.